Okay, so today's presentation is going to be on psychological disorders. So, psychological disorders are behavior patterns or mental processes that cause serious personal suffering for a person. So, what this means is that they cause the person to experience emotional distress, or very, very negatively can impact somebody's quality of life. And also, these behavior patterns can interfere with someone's ability to do the day to day, everyday things that they need to be doing. So, for example, it might interfere with their work or education, it might interfere with relationships. Um, Mental disorders are believed to be uncommon in our society because there's something that we don't talk about very often. There's not as much emphasis on mental health as we place on physical health. Like, for example, people go to the doctor every year to get a checkup, but it's less common for people to go talk to a mental health professional to get a mental checkup. So, for those reasons, psychological disorders seem very rare, but they're actually not. They're actually very common. About 23% of Americans will experience or have experienced a psychological disorder at some point in their lives. So that is somewhere between a fifth and a fourth of the US population. And this is consistent across the world as well. So worldwide, about 20% of the population does has suffered from a mental disorder at some point. So, in order to determine whether or not somebody has a mental disorder, this is the criteria that's used. So, because mental disorders are so abstract sometimes, or because the symptoms are not always black and white, it's important for mental health professionals to have criteria to determine whether or not somebody's behavior or thought process counts as a mental disorder. So, for example, everybody goes through anxiety and depression at some point in their lives. So that anxiety is considered normal under many circumstances. Depression is considered normal under many circumstances. Like if you lose a loved one, if you lose your job, those things can cause depression. But then the question is, at what point do these behaviors become mental disorders? So this is the criteria that's used to determine whether someone's suffering from a disorder that could be diagnosed. Typicality means that the behavior is typical or average when you compare it to the rest of society. So, for example, if somebody has a family member that passes away, it's very normal or typical for a person to be depressed because of this. So, if someone's depressed following a funeral, that's not always considered to be a sign of major depression. That's just a temporary situation. But if somebody is suffering from depression for a reason that's not very typical, or maybe there is no specific reason, then at that point, that's something to look into a little more. Maladaptivity is when somebody's behavior impairs a person's ability to function every day and do the things that they need to be doing. So again, for example, if somebody's, depressed and sad following the loss of a family member, but they're still able to function, they still go to work, they still are able to take care of their homes, that is showing that they're still able to adapt throughout the day, where someone is extremely depressed or really suffering from this, and maybe they're neglecting their hygiene, or maybe they're no longer able to do their job because they can't focus, or maybe they haven't been able to go to school due to their depression, then that would be an example of maladaptivity. Emotional discomfort looks at whether or not the behavior causes serious, personal suffering to that person. And then social acceptability means, does behavior violate society's accepted norms? So again, for example, if somebody's very depressed after losing a family member, that is considered something that we deem normal or acceptable based on our standards. But if somebody is depressed for a reason that's unknown or a reason that's not very clear, it's something that society might not deem as accepted. So this book is called The Diagnostic and Statistical Manual of Mental Disorders. It's abbreviated to the DSM. We're currently on the DSM-5, so there are new revisions that come out, every once in a while, and it is updated. And so the DSM is a giant book of mental disorders, and it's used to classify and diagnose them. So when somebody believes that they're suffering from a mental disorder and they go to see a mental health professional, that person uses the DSM to look up the symptoms and use that criteria to diagnose the person with a disorder. It's very important to have something like this because it adds consistency. If somebody's suffering from a physical illness, say like strep throat, there's testing for that. So it can be easily confirmed that somebody has a physical illness or not based on lab tests. But with mental disorders, it's much more difficult to diagnose because there's not scientific, lab work that can be done necessarily. So it's important to have this criteria and for mental health professionals to follow it so that people are getting consistent results as far as being diagnosed with a mental disorder, and that people who suffer from the same symptoms are being diagnosed the same way. Okay, so our first category of mental disorders are anxiety disorders. Anxiety disorders are disorders that have to do with somebody who feels extreme dread, nervousness, their inability to relax and stay calm. So somebody who goes through periods of anxiety very often. Anxiety is normal. So again, like these symptoms can be normal at times. People do feel anxious for many different reasons throughout, the days of their lives. But when anxiety starts to interfere with daily life, so I'm going to go back to the slide. When someone's anxiety is very extreme, above average levels, or when it impairs someone's ability to function every day, or causes extreme distress, that's when someone can be diagnosed with an anxiety disorder. Down here, below in the bottom part, those are some of the anxiety disorders that we're going to be covering. Okay, so the first one's a phobia. Phobias are irrational and excessive fears of a specific object or a specific situation. So, and everybody, again, it's normal to be afraid of certain things. So everyone, or at least most people, do have fears, but a fear is considered to be a phobia when the person's fear takes over their lives, and when their reaction is much stronger than what an average person's reaction would be. Okay, so for example, if someone's, afraid of dogs and, they just don't like dogs, and that's a fear. But when somebody has a dog phobia, their fear interferes with their daily lives. So again, that's maladaptivity. So let's say that a person has a dog phobia that's so extreme that they can't leave the house if the neighbor's dog is outside. Now that interferes with their lives if they can't go to work that day because they're too afraid to leave the house because they saw a dog. So that would be an example of maladaptivity and phobia versus fear. Okay, or if someone's afraid of a spider and they just don't like the spider, or they step on it, then that would be considered average behavior. But if somebody is so afraid of a spider that when they see the spider they start going into panic attack and they start sweating and crying and screaming to an excessive amount, then that would be considered an extreme fear. And sometimes phobias are irrational. It's not unheard of for people to be afraid of things such as feathers or, butterflies, for example. So a phobia can exist for any object or any situation, not just the things that people deem scary on average. Here's some examples of common phobias. But again, there's a word for any type of phobia, so any situation can be one. Social phobia is when somebody is fearful of social situations, again, to the point where it causes extreme emotional distress to be in social situations, and when their fear is keeping them from progressing in their daily lives. So, there are definitely people that are shy or nervous around others, or more introverted, and that's considered to be normal. But someone with a social phobia is so afraid of social situations that they have trouble going to school, or they have a hard time, they can't get a new job because in the interview they start panicking when they have to meet the interviewer. All right, panic disorder is an anxiety disorder that is marked by frequent panic attacks. Panic attacks are where they're shorter, like in the sense that they can last for like a few minutes to maybe more minutes, but a panic attack is these very intense episodes where somebody is going through very, very, very extreme, intense anxiety. So somebody going through a panic attack, they can suffer from shortness of breath. They might feel dizzy. They might start sweating, feeling like they're choking. They might feel nauseous or throw up. Sometimes people who are experiencing a panic attack and don't know that that's what they're having, they might think they're having a heart attack or that they're dying, because these symptoms can be very physical and very extreme. So people with panic disorder, they oftentimes have a hard time going out in public because they're afraid that they're going to have a panic disorder while they're driving or while they're in class or while they're at the mall. So they a lot of times people with panic disorder tend to avoid going out in public because they don't want to experience that. So panic disorder is linked with agoraphobia. Agoraphobia is the fear of being in public places or crowded situations, especially when being able to escape might be difficult. So people with panic disorder often develop agoraphobia and become afraid to go out in public because they're afraid that they're going to have a panic attack and not be able to escape or go anywhere to calm down. So, for example, they might have a hard time going to school because they're afraid of having a panic attack in the hallway between classes. All right, somebody who suffers from generalized anxiety disorder is often anxious or suffers from extreme anxiety, but over not a specific reason, just over everyday things. So this is different than a phobia. So with a phobia, it's one very specific situation that causes somebody fear and anxiety. With generalized anxiety disorder, people are anxious or scared or fearful in every situation. So excessive worry about finances, about their jobs, about school, about social relationships. This is actually one of the most common anxiety disorders and one of the most common overall disorders in the United States. And so again, it is normal to feel anxious about different situations, again, like school, work, money, so on. But someone with GAD, their anxiety is very extreme. It keeps them up at night. It makes them feel physically sick. They're unable to focus on anything else. They might not enjoy, social things anymore. They might not feel happy ever throughout the day because their worry and their anxiety has taken over to the point where they can't focus on anything else. And in order for someone to be diagnosed with generalized anxiety disorder, this anxiety has to last for 6 months. So again, if you're going through a very stressful situation, as many of us are now, with trying to finish up classes online and with the virus going on, it makes sense for people to feel anxious. But when someone's going through extreme anxiety that lasts for more than 6 months, then that's when they're going to get a diagnosis with this. All right, obsessive compulsive disorder is one of those disorders that people kind of misuse the term very often. So it doesn't mean that a person is very neat and organized. It doesn't mean that they're clean. It means that somebody is going through extreme anxiety in the form of obsessions. So obsessions are unwanted thoughts that don't go away, and you try to get them to go away, you try to get them out of your mind, and they just don't. Okay, and these are very negative thoughts, usually about bad things that are going to happen to you. So then, as a way of coping with these obsessions, because these obsessions cause the person extreme worry and anxiety, as a way of coping, the person performs what are called compulsions, and compulsions are repetitive ritual behaviors that they will do over and over and over again to try to relieve that anxiety. So one example would be excessive cleaning or obsessive checking things or any other compulsion. So for example, a very, very common obsession with OCD is the thought of contamination or germs. So these people become very obsessed with being contaminated, potentially, dying from illness due to a germ that they touched, or that everything's dirty. So the compulsion of kind of relieving that stress is people who constantly wash their hands. And frequent hand washing is one of the most common compulsions, where people will wash their hands over and over and over again with like the hottest water. So they're like burning themselves and like scrubbing their hands till their skin is cracking and bleeding because they cannot make themselves stop. Okay, another example is frequent checking. So someone might be obsessed with the idea of like danger or an intruder. So they have a hard time getting ready to go to bed because they have to check every lock like 3 times, and they have to walk around the house constantly throughout the day to check the doors and check the windows and check the lights. Okay, so again, OCD has to do with obsessions, those repetitive thoughts, and then compulsions, repetitive behaviors that they can't break. Okay, and then the next one is post-traumatic stress disorder, or PTSD. So somebody who experiences PTSD has gone through a traumatic event in the past, and which causes symptoms later as they try to cope with it. This is very common for people who suffered like a severe injury, a bad accident. It's very common for people who suffered from abuse or some type of physical attack. It's common for people who have been hospitalized or had like another severe health crisis that caused them a lot of fear. So there's a lot of different types of trauma. It's very common with military, especially people who like served in combat and had to see some very disturbing things during their time. Car accidents, terrorist attacks. So there's a lot of different stressors that can cause PTSD. But so then when somebody has experienced that extreme situation, some of the symptoms that can occur are flashbacks and nightmares about the incident. So someone might be like caught up in a flashback of not being able to mentally escape that moment that happened in the past, or having constant dreams about that. Sometimes people with PTSD have what is called numbness of feelings, meaning they don't really show emotions or like, reactions. They're just kind of like numb, monotone. They don't have like emotional ups and downs throughout the day. They're just very withdrawn. A lot of times they avoid social situations because of this. They have a hard time concentrating. Another symptom is avoiding things that remind them of the trauma. So for example, if someone was in a really, really bad car accident and now suffering from PTSD, they might avoid that intersection, or they might be afraid to drive because it causes them a lot of fear to remember that incident. Okay, so why do people develop anxiety disorders? There's a few different views based on different perspectives that we've covered so far. There is evidence that anxiety disorders can be based on genes. The anxiety or tendency to suffer from anxiety does run in families, so there could be a genetic component there. Also, this could have to do with the way the brain is built on like handling stress. Okay, according to the psychoanalytic view, so again, going back to like Freud's ideas, he believed that when people repress things in their unconscious mind, that anxiety can result. So that could be a reason. According to the learning view, phobias are learned or conditioned. Um, so, for example, if somebody's afraid of dogs, it could be because maybe they were bitten by a dog when they were younger. So that could be a reason why. So past experiences can lead to anxiety, or maybe someone suffers from test anxiety because in the past they haven't done well on a test, so they've kind of like learned to be afraid of those things. And according to the cognitive view, anxiety is caused by people's negative thought processes or irrational thoughts. So people believing that certain situations are scary and putting themselves in that mindset. So again, you don't have to agree with like all of these views, but just kind of understand where these different perspectives are coming from. All right, the next category that we're going to discuss is dissociative disorders. Okay, so with the dissociative disorders, what happens is someone's personality or their mental process splits away from their consciousness. So dissociation is a normal thing that people do sometimes. So, for example, if you're reading and you get really caught up in the story and you kind of forget that it's a book because you're mentally in the book, that would be an example of dissociation. Or if you're like daydreaming, so maybe like physically you're in class, but mentally you're somewhere else thinking about your vacation coming up, that would be an example of dissociation too. But dissociative disorders happen when someone's dissociation is very extreme. And a person is like unable to kind of like pull themselves out of it. So the two dissociative disorders we're going to cover are dissociative amnesia and dissociative identity disorder. Dissociative amnesia is when someone suffers from a very sudden memory loss, and usually it follows a traumatic event. So someone will go through this traumatic event, and then all of a sudden they can't remember things. They don't remember who they were. They don't remember their name. They don't remember their friends, where they live. They just totally, like, their memory just blanks out. And the key here is that this is not due to any type of brain damage or physical injury. So if someone's in a car accident and they have a concussion or some severe brain injury and they lose memory, that would be a physical injury because the brain is a physical part of your body. But if there was no brain damage and no other physical symptoms, yet somebody still is unable to remember things, that's when it turns into dissociative amnesia. And then dissociative identity disorder used to be called multiple personality disorder, but now it's called dissociative identity disorder. So it is abbreviated DID. This is when two or more personalities or individuals reside within the same body. Sometimes they're aware of each other, sometimes they're not. But the different personalities or the different identities take turns controlling that person's physical behavior. So when someone's suffering from DID, the different personalities found within that body are just as different from each other as you are different from all of your classmates. They can differ in age, voice, facial expression, their behavior, the way they describe their physical characteristics. So obviously, if they're in the same body, they're all going to look the same. But if you were to ask the different identities to describe themselves physically, they would say different things because they see themselves as different people. They can be different genders, different, accents. They can vary just as much as any 2, 3, 4 people in the world can vary from each other. So they're not, they don't consider themselves to be part of each other. They just consider themselves to be 5 people all stuck within one body. Okay, mood disorders are disorders that have to do with emotional extremes. And when the moods are not consistent with whatever situation's going on or they're not appropriate for the situation. Okay, so again, like if someone's depressed during a funeral, like that's considered to be appropriate and consistent because that's typical. But if someone's experiencing depression and there's not really like a good reason why, or nobody's really sure why, then that would be something worth looking into. Major depression is the number one most common psychological disorder throughout the US. Um, and it's something that does require immediate attention. So severe depression is pretty distressing, and about 15% of severely depressed patients do end up committing suicide. So this is, again, another example of why it's so important for mental health to be focused on as well as your physical health, because it controls somebody's life just as much as physical health does. So for a person to be diagnosed with major depression, out of these symptoms below, a person must experience at least 5. And the symptoms have to last for at least 2 weeks. So that's the criteria that's used. So you've got somebody who feels depressed for most of the day. If the person has lost interest, so they no longer enjoy activities that they used to enjoy, they no longer enjoy socializing, maybe they're not interested in their friends or relationships anymore, that's a symptom as well. Eating habits can change. They can increase or decrease with depression. So someone who's experiencing significant weight loss or weight gain in a short amount of time, that could be a sign. Sleep patterns will change too. So somebody who is sleeping more than usual or less than usual could be depressed. Emotional reactions means somebody's like emotional expressions and emotional ups and downs throughout the day. So when someone is speeding up their emotional reactions, that means they become very emotional very quickly. They experience very extreme like highs and lows in their emotions. Where somebody who has a slowing down of emotional reactions, it means that they don't have emotional highs and lows. They don't react to things. They're just kind of like even, like monotone throughout the day. Fatigue and energy loss is another symptom. Constant feelings of guilt or worthlessness, reduced concentration, and recurrent thoughts of death or suicide. So again, out of all of these symptoms, someone will have to have experienced about 5, and they have to last for 2 weeks to get the diagnosis. And then bipolar disorder is, again, this is another term that people misuse very often when someone is emotional. Sometimes people call that person bipolar. That's not really what this means. Bipolar disorder, a patient does experience depression. So all the symptoms we talked about on this slide, a person with bipolar disorder also experiences those symptoms. They do some days suffer from depression, but the difference is that on other days they go through cycles of what is called mania, and mania is like the extreme opposite of depression, okay, or it's called a manic episode. So somebody who's going through mania, they go through periods of extreme excitement and hyperactivity. So their behavior becomes very chaotic, very careless, very reckless, very just kind of all over the place and erratic. They might experience inflated self-esteem, like they believe that they're like superior, like extreme inflated self-confidence. They have the ability to sit still or sleep restfully. Like they just, it seems like these people have no off switch when they're going through mania. So sometimes people going through a manic episode, they appear as if they're on drugs when actually it's their brain is making them so jittery and like fidgety and they can't sit still. Their talking patterns, their speech becomes very sped up, and they're constantly jumping around from topic to topic. Their thoughts race, and they also have difficulty concentrating. So a person with bipolar disorder balances back and forth
between depression and mania in these different cycles. And the cycles can last for a few days each, or like a week. It kind of depends on the person. But so this person never really has even days. They're either very depressed or they're going through mania. So here's an example. This is a brain scan of a bipolar patient. You can see the dates on the bottom. So these are all within, a few days of each other. So the more activity, that's when you see these like yellow and reds. So when somebody is going through depression, depressed patients do show slowdowns of brain activity. So you can see here on May 17th and May 27th, this patient had very little brain activity. Their brain wasn't doing a whole lot. But when someone's going through a manic episode, their brain totally speeds up. So you can see here there's a ton of activity going on here in this middle picture. And even you can see these are like exactly 1 day apart, and there's a very drastic difference in what that person's brain looks like as far as how much energy that brain is using. So that's huge biological evidence for this. Okay, so explaining how do mood disorders occur. According to psychoanalytic view, Freud would say that depression is a result of something, again, some childhood experience, something that happened that causes depression later on in life. Something going on in your unconscious mind. Biological view looks at, again, they look at brain structure. So again, they go back and look at your neurotransmitter levels, brain chemistry. So again, we can see here, again, the brain is playing a role in these things, as well as these neurotransmitters are specifically linked to mood disorders. So people who suffer from depression do have lower levels of serotonin and lower levels of noradrenaline. Okay, and there's also evidence of genetic factors as well, that these disorders can run in families and be biologically inherited. Okay, according to the cognitive view, negative thought processes contribute to mental disorders. So cognitive psychologists focus on how does somebody's thought process cause depression, or how does it cause bipolar disorder? How does somebody's thoughts like just cause their mood to become so extreme? So I put a few examples on here. So people who tend to blame themselves, or people who believe that their problems are really like bigger than they are more likely to suffer from depression. All right, our next category is somatoform disorders. Somatoform disorders are psychological problems that show up as physical problems. So the two types we're going to talk about are conversion disorder and illness anxiety disorder. It used to be called hypochondriasis, but since then the name has changed to illness anxiety disorder. Keep in mind that people who fake illnesses to like get out of things, that is not a somatoform disorder. Or people who try to be really healthy, or they don't want to get sick, that's not a somatoform disorder. These disorders are a little more extreme than that. Okay, so one example is conversion disorder. Conversion disorder is when someone suffers from physical symptoms, but they don't experience, like there's no physical reason or medical explanation. So for example, someone might wake up one day and all of a sudden they're blind, or all of a sudden they're paralyzed, or they have extreme pain and it's like they don't know where it came from. So again, there's no physical reason. So if somebody is suffering from sudden blindness but they had an eye injury, then that's not a mental disorder, that's a physical injury. But if someone's suffering from sudden blindness and there's no eye injury, nothing happened to them, no brain injury, nothing going on, no drug use, like nothing, then that would be considered conversion disorder, because there's something psychologically going on with them that's making them feel like they're unable to see. Okay, or another example would be paralysis. Like if someone physically can't function on parts of their body, but there's no physical reason for it. And illness anxiety disorder it used to be called hypochondriasis. So someone who suffered from this, have you ever heard the term hypochondriac? This is where it came from. This is a person who constantly believes that there's something wrong with them and that they suffer from a serious disease. So you have like sometimes you have like minor symptoms and you type them into, WebMD, or you Google your symptoms and it tells you have all these severe things and you get really freaked out. That's what a hypochondriac goes through every day. So they have minor physical symptoms that we all have: cramping, headaches, fatigue, random pains and aches here and there. But they really believe that they have some type of physical severe injury or illness that they're suffering from. So somebody who has a headache believes that they have brain cancer. And these people go from doctor to doctor seeking treatment, seeking reassurance, and doctors tell them there's nothing wrong with you, you're fine. They don't believe the doctors, so then they go to more doctors, and they get very frustrated because they are constantly being told that there's nothing wrong with them. So that's what hypochondriac does. Okay. Schizophrenia is not just one disorder, there's many types of schizophrenia. This is a very, very disabling disorder. It's rare, but this is one of the most severe. So, someone who suffers from schizophrenia, the main part is that they totally have lost contact with reality, and they just kind of like have no idea what's going on. They suffer from hallucinations, bizarre thoughts, delusional thoughts, and they just like totally lost touch with like what's going on in the real world. So the three main types of schizophrenia. So we've got paranoid, disorganized, and catatonic schizophrenia. Paranoid schizophrenia is when somebody they suffer from frequent hallucinations. Hallucinations can be any of the five senses. Most of the time, though, these are auditory, which means they hear voices or things that are not there. And a lot of times the voices tell them very negative things. So like scary things or and like kind of like negative, degrading things, but they hear them as if they were real voices. And actually, they're it is very real to them, even though the voice, the source of that voice might not be there. Someone with schizophrenia, their brains react just like our brains react when we actually hear sounds. Sometimes it could be visual. Sometimes it could be like touch, like they might feel things crawling on them that aren't really there. So there's lots of different ways these hallucinations can affect somebody. They also experience what is called delusions of grandeur, which means that they become very paranoid or they have these very bizarre thoughts. They might believe, for example, that the government is, coming to, kidnap them, or they might believe that, there's aliens, living in their neighborhood, or they might believe that they're an alien or that they're a robot. So just very like bizarre thoughts that they have a hard time escaping. Organized schizophrenia is someone who suffers from incoherent thoughts and speech. So their speech patterns and their thoughts are just kind of like all over the place. It's very difficult to have conversations with these people. They often appear messy or disorganized. They kind of like reject hygiene, and a lot of times they show very inappropriate emotions. They might become very reactive or very emotional or extreme in their emotions. And sometimes they might have what is called flat affect, which means that they can sometimes become emotionless or don't have ups and downs in facial expressions like most people do. Catatonic schizophrenia is mostly marked by a disturbance of movement. They might hold what it's called catatonic state, very unusual positions for long periods of time. So here's some examples of what a catatonic state might look like. And they just kind of like hold these positions and just kind of like lose touch of where they are or what they're doing. So they can hold these for minutes and minutes or close to an hour even. So again, going back to these three: paranoid, disorganized, and catatonic schizophrenia, sometimes
the symptoms between the three kind of cross over, and someone might experience the symptoms of all three. So in that case, it would be like an undifferentiated type of schizophrenia. So Freud believed that um, when the id and ego are constantly in tension with each other, and when all that's going on in your unconscious mind, that this can cause these bizarre delusional thoughts, or that it can cause hallucinations. Biologically, we know that schizophrenia is linked to genetic factors. It can run in families. If you have a genetic relative that had schizophrenia, you're more likely to have it yourself. Dopamine is a chemical in the brain, it's a neurotransmitter. People with schizophrenia do have heightened levels of dopamine. So there is evidence for chemical imbalances in the brain to play a role. Out of all the schizophrenia patients that have been researched, a lot of them have suffered some type of trauma or injury during birth that might have caused issues with brain development. Also, schizophrenia can be linked to viral infections that took place during prenatal development. Um, Evidence for this is that out of schizophrenia patients, most of them have winter birthdays. So that kind of like, I'm not saying that if you have a winter birthday, you're more likely to get it, but it's likely that people who suffer from schizophrenia, one of the factors that contributed to it could be some type of infection, because winter also coincides with flu season. So it could be something that has to do with a viral infection during times when the brain is still developing. All right, and then there's also differences in brain structure with schizophrenia here. So these are identical twins. You can see they're two 44-year-old males, and they're genetically related to each other. And the patient on the left is the non-schizophrenia patient, and the patient on the right has schizophrenia. You can see the main difference in their brain is that, so in all of our brains, we have this little like butterfly shaped hole. These are called ventricles, and this is just like a hole that we have in our brain for some reason. But patients with schizophrenia do have enlarged ventricles, so the holes are a little more swollen, and this can represent more tissue loss, because obviously if a hole's bigger, that means that the tissue has been kind of lost a little bit more. Also, people with schizophrenia, their ventricle here is filled with fluid, when a normal person's brain, there is no fluid in here. Okay, and our last category that we're going to discuss is personality disorders. So personality disorders are treated a little differently than the other mental disorders that we talked about. The other mental disorders that we talked about are considered to be mental illnesses, or like disabilities in some cases. They're considered illnesses that could be treated, right? So like there can be medications prescribed, or other forms of therapy. So a personality disorder is somebody's personality. It's very extreme personality traits that cause a person to be like unable to like function daily, or their social life or professional life might be disrupted, but it's not considered a mental illness that can be treated. It's considered someone's personality and problems with their personality. So, again, here's some of the differences, kind of like recapping this. So, psychological disorder. So, if someone suffers from schizophrenia, that's not considered someone's personality. It's considered an illness that needs to be treated. Somebody with a personality disorder, like that's considered part of somebody's identity and their personality. So again, somebody can work on changing these traits, but it's not treated the same way as an illness. All right, so here's the four we're going to cover. Paranoid personality disorder is someone who's extremely distrustful or suspicious of other people. So they do not trust people. They often find threats out of people's words or actions, or constantly feel insulted. So, for example, if you told a person with this disorder, like, "Hey, oh, I like your new haircut," they might perceive that as an insult or sarcasm when really you meant it as a genuine compliment. Okay, or they might perceive your behavior as being very threatening or mocking to them. So a lot of times people with this disorder come off as very argumentative or very cold, because they're so distrustful of other people. Or, they might believe that, if they sit at the same lunch table with somebody, when they might really believe that when they get up to go throw their trash away, that everybody talks about them and makes fun of them. They might not like really trust their friends even. So they have a hard time like keeping relationships because they don't trust people. A schizoid personality disorder is somebody who is not interested in relationships with others. They just don't see the point in connecting. They're not interested in connecting with other people. They tend to not enjoy social situations, not out of nervousness or fear. They just generally don't like being around others. So they become very like reclusive, tend to not have very many friends, and they tend to not be very emotional in the sense that they don't, laugh as often or cry as often as most people do. Okay, antisocial personality disorder is another one. People like kind of misuse those words a lot. So it doesn't mean shy. Antisocial personality disorder, it literally means against society. So somebody who does not, they violate other people's rights and they don't feel guilt or remorse about like hurting other people. So they often disregard other people's feelings and other people's rights. So people with antisocial personality disorder, they're often in trouble, and it starts early on as children. So it starts, even in elementary school, they are the bullies in school, or they're the ones constantly, physically hurting other classmates or bullying or like being verbally aggressive toward people. Even as kids, they might start off as stealing or cheating, lying. It eventually graduates to more extreme measures. So people with antisocial personality disorder are known to like have hurt animals during childhood before it moves on to more severe things. Like as adults, they tend to become very aggressive. It's more common for someone with this disorder to assault people, commit crimes. For these reasons, they might have a hard time holding a job. Again, they don't have very ethical behavior, so they break the law very often. Um, in prisons, a huge percentage of prison populations have been diagnosed with antisocial personality disorder. Because, again, when they hurt people or they steal things or they do things that are wrong or just things that are not good behavior, they don't feel remorse. They don't feel guilt over it. They truly don't care about the rights of other people. Here we have evidence that antisocial personality disorder is linked to lower activity in the frontal lobe. So this is two different brains. The frontal lobe is here. Okay, so this is where the person's like face would be, where my cursor is. So the frontal lobe is the part of the brain that contributes to impulse control, planning, making good decisions, thinking, critical thinking. Out of most people that have antisocial personality disorder, there's very, very reduced activity here in that frontal lobe. So that shows evidence for why these people don't tend to have impulse control or they don't make good decisions. And interestingly enough, a lot of people in prisons, especially people convicted of violent crimes, they also show very much reduced frontal lobe activity. So that's one of the debates in our justice system right now is if somebody suffers from reduced brain activity here in their frontal lobe, like how much to what extent can we hold them accountable for their actions, and is prison really the best option? So just something to think about. And then somebody with avoidant personality disorder is extremely shy and fearful of social situations. So people with this disorder, they are very, very fearful. So it's like social phobia, but a lesser version, but very similar, where they're often just very afraid to be around people, very afraid of interacting, very nervous. And so they often avoid social situations out of not wanting to be around other people because of fear. And that was our presentation. So thank you for watching. Let me know if you have any questions or if there's anything else you'd like to discuss. I'm happy to help you, but thank you.